Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
I think epilepsy is a grossly misunderstood problem. I think it's a good initiative that we can get more insight about epilepsy and try to dispel some of the myths around the condition.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Seizure is, by definition, any abnormal electrical activity in the brain. So what we have is some parts of the brain are overactive and they just work, and there's excessive electrical activity happening, and so it loses the normal function and instead there is a lot of abnormal activity happening. This can manifest in different ways depending on which part of the brain is affected. So that's when we have the different types of seizures, what we call the classical generalized seizures, tonic-clonic seizures, what we see depicted in films where the hands and legs are moving very quickly and the patient loses consciousness. Or again, they have other types of seizures, just as patient just they become a bit unaware of surroundings, they get confused, they just lose the ability to speak for a short while and things like that. How this affects the brain is that every time there is a seizure, a loss of, there are some brain cells which get affected. So once this starts to get accumulated over time, they can have deleterious effects on the brain, leading to permanent damage in certain parts of the brain.
What is epilepsy?
Epilepsy is a condition where it is defined as basically two or more. So basically what that means is somebody is having seizures cause. Sometimes you can have a stroke and then have a seizure. Sometimes you can have low blood sugar or high blood sugars and have those are called provoked seizures. So if there's no obvious cause and somebody is having seizures, which is called unprovoked seizure, and two or more of them in one person is what constitutes the definition of epilepsy. So a diagnosis of epilepsy basically means that this person has a risk that the seizure will recur again. So then this means that they will need medication to prevent the seizures from occurring.
What are the different types of seizures? And do they affect people differently?
As I initially mentioned, the type of seizure depends on which part of the brain is affected. So we have a gross definition, that is generalized seizure, that the whole brain is affected. Just when we have your jerking and loss of consciousness, the uprolling of eyes, drooling of saliva, tongue bite, it's all your classical seizure. And then you have a lot of these focal seizures, which are specific areas of the brain. So if you have seizures affecting the part of the brain which just deals with vision, you can have just hallucinations. There can be a manifestation of seizure. And if that only the hearing area is affected, you can have hearing hallucinations. Sometimes just smell can be abnormal. And you can have fear, sometimes just a sensation of fear, abnormal sensations all over the body. A bit of tingling in the arms can be a seizure. A bit of unawareness, a confusion of where you are. All of these can turn out to be seizures. So there are lots of different manifestations of seizures, and it all depends on which part of the brain is affected first. Sometimes these small seizures or focal seizures can just spread and they can start to involve other parts of the brain, and overall you can have generalized seizures as well. So it is when the generalized seizures can be life-threatening, while this focal seizures they can interfere with your quality of life, and as I said, they can accumulate over time and lead to permanent brain damage.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Worldwide, there's been a lot of evidence that at least 50% of people with seizures, we are not able to find the cause. So what we call idiopathic. So there are a lot of causes. The causes vary with age. In younger people, it is much more likely that they can have seizures due to an infection of the brain, whereas in older people, even a stroke can result in a seizure, and of course, tumors can cause seizures, head injuries can cause seizures. And sometimes there are even in the extremes of age, low blood sugar and high blood sugar can lead to certain seizures. Alterations in your electrolyte levels can lead to seizures. Abnormal renal function, loss of kidney function can lead to seizures. So there are lots of causes which can lead to seizures, and each of them, and at each age, we always think of certain causes as being much more likely. So to evaluate all these, we do these scans, we do the blood tests, we do EEGs to look at if we can find a specific region of the brain which can lead to seizures and all of those. Some of them can even have genetic causes of epilepsy, which usually most of them start in an early age, usually before 5 years of age, and sometimes up to 15 years of age. But the genetic causes, of course, they can be diagnosed only with a genetic test based on suspicion.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
So depending on specific type of seizure that they have, so somebody might have only generalized seizures. If they have to have only generalized seizures, they can have something called an aura. That's a symptom starting just before the seizure, which tells them the seizure is going to happen. Some of them might have noticed that they have a cry. The patient cries or shouts just before the seizure occurs, or they suddenly become very quiet or sit down somewhere before the seizure occurs. So if they notice something like that, the caregiver has to be alerted that they might end up having a seizure, and if they can, need to make sure they did not injure themselves when they're having a seizure, because that is the most important part. So most of the time, and these focal seizures, it's much more easier to recognize because all of these they have very very specific symptoms which the patient will be able to tell you about. And when they have these symptoms, and it can vary depending on what type of seizure it is. So if the patient, of course, notices one of the symptoms, they should alert the caregiver they might be having a seizure, and which is the caregiver's main role at that point is to use any abortive medication if they have been prescribed that, or make sure that the patient does not injure themselves during the course of the seizure. The problem is, unfortunately, there are many myths that giving iron in the hand during a seizure can actually terminate, but that can be more harmful than beneficial because they can actually harm themselves with the heavy rod or something which they have in hand. So make sure they lie on a surface, make sure they are on their side, make sure their head is not tilted backwards because their tongue might fall back and affect their breathing, and make sure they don't bite. If they bite their tongue, make sure they're not swollen. Stop. So these are the things that the caregivers need to do.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
As I said, many a time we are not able to tell the exact reasons, and this has led to, unfortunately, a lot of myths around the condition. In our country, especially, there's a condition that maybe God has cursed, there's been a curse put on you, God has come into your body, and things like that. So what happens is that, and many times this is attributed to bad karma, or this person might have an affliction which can affect their whole life. That is not true. Many times people with seizures lead fruitful lives. 80% of seizures are controlled excellently, and they do not affect day to day at all. This has led to an extreme stigma where people with epilepsy or seizures are often overlooked when it comes to employment. People have a fear of getting married, people have a fear of having children with them. These are all baseless because there is no evidence that any of this has to be affected by seizures. So people with seizures can have fruitful lives, they can be extremely productive in society, they can then go on to have a long lives with families as long as they take it properly.
How does this stigma affect people with epilepsy?
The stigma, unfortunately, can lead to both monetary isolation as well as social stigmatism. So when they're socially stigmatized, they have a lot of difficulty making friends. Especially their small children having seizures, the parents of their friends might tell them not to play with them. This leads to a stigmatization, and they do not have friends growing up. It's going to lead to other mental health problems such as depression and loneliness and things like that, and suicidal ideation. Unfortunately, this can lead to lower compliance with seizure medications, which in case lead to increased frequency of seizures. This is a vicious cycle, and we need social support and family support to ensure that patients are compliant with the treatment protocol so that they live fruitful lives. And the other end is that they do not get employed. The employers are wary of hiring people with seizures, that it's leads to monetary imbalance. So people don't have, they're not able to earn. This again leads to the same vicious cycle of depression and the dependence and all that, other mental health issues.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
So as I
Yeah.
was saying, the most important trigger for seizures in somebody with epilepsy is missing a dose of medication. So it's very important they do not miss doses of medication. The other important trigger, which is often overlooked, is proper sleep. People need to have at least 8 hours of sleep every day.
Yeah.
A missed night of sleep can lead to seizure anytime within the next 2 to 3 weeks, unfortunately. The other triggers are usually very specific. Uh, so it depends on people. So some people are sensitive to say bright lights. So if they watch bright lights for a long time or watching TV for a long time, it can lead to seizures. This way, we always tell them to break up their screen time, because some people are working. If they work on working in IT or things like that, they have to look at screens the whole day. But it's usually advisable to take breaks in between. And of course, if there are strong smells which can trigger your seizures, try to avoid those smells. There are some people have certain foods which can trigger seizures, like having chocolates and cheeses, strong cheeses can sometimes trigger seizures as well. So these are things which are specific to each person and needs to be avoided. But the first and foremost thing to be avoided is do not miss any dose of medication and make sure you get enough sleep.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
When you see somebody having a seizure, make sure they are not surrounded by anything which will injure them. Make them lie down on a flat surface, preferably a soft one, and please make sure that they lie
Yeah.
down on the side and not flat, because they may end up swallowing their tongue. So these are three things we can do. We can greatly reduce the risk of injury with somebody having seizure.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Seizure and epilepsy are grossly misunderstood conditions, but they are eminently treatable conditions. I urge everybody who has epilepsy to not be stigmatized with it, to own the condition, and just follow whatever your healthcare provider tells you to, because most of the time, once you're on proper treatment, it should not affect your quality of life at all.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.